Good afternoon, everybody, and welcome to another edition of On the Clock with Personal Living Alert. I'm David, and I'm with Personal Living Alert, and today I am truly honored to have Joseph Bensmihen. Joe, or better known as JB, is the president of the Private Care Association. That association oversees, for lack of a better way to say it, all of the nurse registries in the United States. But I don't want to get ahead of myself. I'm going to let JB do all of that. But JB, I just want to say hello and nice to have you on the show, and I'm truly honored.
David, thank you for the invitation. I'm always happy to do something different and new while we're in quarantine. So thank you so much. I can jump right into it if you'd like and explain what the Private Care Association is, or I can.
Before we do that, I want to ask you about your background. You are the most unique person we've had on so far, and I don't think anything you can say would do justice until you gave us maybe 2-3 minutes on who you are, what's your background, and why did you get into this market. So I'd love to start there.
Sure. So I actually got into the market because the market found me. I have a master's degree in social work from Yeshiva University in New York, and I graduated in 1995. And I shortly thereafter moved to Florida and became a social worker working for the city of Deerfield. I was working for the city of Deerfield for 6 months, and then an opening happened at a national home health care company, and I became their per diem social worker. In the year 2000, when Bill Clinton and Newt Gingrich balanced the budget, they actually balanced the budget on the backs of the elderly and disabled by balancing the budget by removing certain safeguards in the Medicare beneficiary program. But that caused me to open up a geriatric care management company, and as an offshoot of a care management company, I then became a nurse registry as well. And so using my social work skills, I began to deliver in-home care services. And I'm probably one of the few social workers you will meet that owns I owned a Medicare home health agency from 2004 till 2014, and I've been in the nurse registry business from 1998 till currently. So, unlike my 3,100 predecessors in the state of Florida that own a home health care agency, we were a home health care agency that was driven with a social work model, and we are now a nurse registry that is driven with a social work model.
So before we get into all the nurse registry stuff, JB, what is the Private Care Association?
So the Private Care Association was founded in 1977 by individuals in California who wanted to deliver custodial care, bathing, dressing, toiling, non-skilled care to the elderly and disabled, where the individual who is the consumer dictates what kind of caregiver they want and how much they're going to pay. And so that's how it evolved, beginning, like I said, in California, and then it also in Louisiana, Maryland, and Dade County have the oldest standing nurse registries in the country. In Maryland, you have some registries that have been around since 1950s. In Dade County, you have registries that have been around since 1964. In Louisiana, you have registries that have been around since 1969. And again, the concept is that we're going to send to your home a credentialed, verified, and screened caregiver, and you're going to decide how much you want to pay them. A great example that I can give you in the real market. So in Florida, nurse registries are about 600. There's about 625 nurse registries in the state of Florida. And the way it works is Mrs. Jones says, I have a limited income, right? And I can pay $20 an hour for home care. I'm using that as an easy number to remember. I can pay $20 an hour, and we say, okay, Mrs. Jones, with that amount of money, we can send you, you have 5 or 6 caregivers that you can pick from, right? And we have some caregivers that want to make $12 an hour. We have other caregivers that want to make $13 an hour. And we have other caregivers that want to make $14 an hour based on their level of expertise in the caregiving business, right? And so Mrs. Jones, who is now realizing, she knows that the caregiver is going to make $13 or $14 an hour, and she knows that she's going to pay basically what amounts to $6 an hour for home care. So her cost is $6 an hour, and the caregiver gets the rest. That recipe in the state of Florida has been a winning recipe, and the Florida legislature in 1991 decided that a free market should allow nurse registries, because when consumers are happy and caregivers are happy, their turnover is a lot smaller when you know exactly how much your caregiver is making and the consumer is paying. And so that's the biggest difference that the nurse registry model offers. It allows caregivers, through a credentialed, verified, and screened process, to become their own entrepreneur. And so it's a win-win for the consumer who's getting care and for the caregiver who's delivering the care.
That's very interesting. Now, how many members are there in a private care association?
Okay, so the numbers are misleading, because I'd like to give you the following analogy. If you said to me, how many people go to a baseball game, right? It's anywhere between 35,000 fans to 40,000 fans to, unfortunately, in Dade County, Marlins Ballpark, to 9,000 fans. But the fans are those who show up to the games, right? So in the registry world, it works the exact same way as the analogy to baseball, right? The baseball owners make up of what, 33 teams? How many teams are there in Major League Baseball? 33, 34 teams. And those 34 teams represent the millions of fans who enjoy baseball. Nurse registry owners represent, there's probably approximately anywhere between 91 to 130 members that are part of the private care association. But you have to realize that in that calculation, you have national chains like Visiting Angels that are a member of the trade association.
Sure.
Right? In that membership, you have individuals who represent who might be found, companies that might be found in all 67 counties in the state of Florida. You might have 6 or 7 owners in North Carolina. So that's how it's, there's about 30 states in the union that are pro-nurse registries. So that's more likely than not where you're going to find the nurse registry model. For example, the state of New York is not, they have a different philosophy in terms of, they believe that you should decide whether or not a caregiver is a good caregiver, depending on how they pay their taxes. All right, I don't believe that. I believe that you should decide whether or not a caregiver is a good caregiver, whether or not they're licensed to deliver the care they're delivering, whether they pay their taxes using a 1099 as an independent contractor, or whether they pay their taxes using a W-2 as an employee, is irrelevant and inconsequential. The best example I can give you to that is at 3 o'clock in the morning, when you walk into the emergency room and you are having chest pains, you don't ask the emergency room physician, are you an employee of the hospital or are you an independent contractor of the hospital? You just want to be cared for. What you'll find with people, there's about 53 million disabled Americans in the United States who live with a disability every day. And I will bet you dollars to donuts that a person who lives with a disability is much better attuned to decide what kind of care they need than somebody who is a nurse who went to nursing school and decides, I'm a nurse, therefore I should tell you how much care you need. And I think that's the fundamental difference between an agency and a registry. A registry, the consumer dictates what kind of care they want. In an agency, the director of nursing dictates the kind of care that somebody should have.
Well, I appreciate that. So it sounds like there are 100 or so members to your association, right? What guidance is PCA giving its members during the COVID-19?
So COVID-19 is again, I wasn't around 100 years ago. And maybe, as George Burns once said, the reason he didn't sign a contract with Caesar's Palace at his 90th birthday. He said that at his 90th birthday, they wanted Caesar's Palace to sign a 25-year extension. And he said the reason he didn't sign it is he didn't think they were going to be around that long. So, I mean, that's a joke. But again, the pandemic of this magnitude, we've never seen it. We've never seen. I will tell you that the Private Care Association, as a trade association, has been in touch with its members, has gained new members based on the, owners look at what the kind of guidance that their colleagues are getting, and they start joining trade associations so that they can get the guidance. The guidance that we've been giving to our ownership, those who are owners of the trade association, is information on the PPP, the payroll protection program, as well as PPE, the personal protection equipment. Everyone, the job of caregiving, right? Like I said before, especially now, when you walk into a hospital, you are not asking if it's a nurse employed by the hospital or is she or he an independent contractor of the hospital. You want to make sure that they are able to care for you when you are having difficulty breathing. And so that is what we are helping. We are finding a lot of our individuals are increasing care. Those who feel that they can manage without care, where care became a luxury, have gone without care. But those who've needed care have enhanced their hours of care. And so we have to make sure that the caregivers that are registered through us are up to the task.
Understood. But when it comes back again to the guidance, let's go back to that, because that's really what I want to know, and that's what people are interested in. Is it more than just what the PPP and the PP?
Correct. Those were examples. The guidance comes from the Agency for Healthcare Administration, right? Every nurse registry in the state of Florida is licensed the exact same way as a Medicare certified home health agency. The only difference is that they can't take Medicare funds. So our guidance comes from the Department of Health, comes from the Agency for Healthcare Administration, comes from the Department of Labor, comes from the governor. We follow the exact same guidelines depending on what states you're in, right? I believe there's one nurse registry or maybe a handful of nurse registries in the state of New York. Their guidelines are very different than the guidelines we have in Florida. So we give people general guidelines and we give them any notices that we might have. For example, if we get a notice on what the state of Maryland is doing or the state of North Carolina is doing, then we'll give out that notice. But we rely on our members to provide a state specific guidance. We are only able to, as a group, deliver national information because that is what the National Private Care Association follows.
As a 1099 employee versus a W-2 employee, right? The 1099er is free to do whatever they choose to do.
What do you mean?
Well, I mean, they're their own business. I mean, right? They can work for who they want to work, charge that they want to work, do what they want to do,
Right.
as opposed to a W-2 employee who really has a boss, so to speak, to answer to. So how does everybody make sure that the 1099 employees are following the guidelines?
Again, how someone pays their taxes is not part of the equation. How someone is credentialed to deliver the care they're supposed to deliver. For example, a caregiver who's a registered nurse or a CNA, right? They carry their license that was given to them by the Agency for Healthcare Administration. So if they're not following the proper protocols, not even just, of course, in the PPE world and the pandemic, but in general, right? An independent contractor that decides to go steal from the elderly is going to be thrown in jail just as much as an employee is going to be thrown in jail. An independent contractor that doesn't have, the domestic violence training or isn't free of communicable diseases, isn't maintaining their what they're supposed to do as a professional, is going to be sanctioned no different than an agency. I always laugh, and I will take any executive of any home health agency. I will go toe to toe with them whenever they want. When they say, well, the difference between a nurse registry and a and a home health agency is that the home health agency supervises their caregivers. There's nothing that could be more nonsensical. There's nothing that's a bigger nonsense than that statement. The only place where there's supervision in the world of nursing is a hospital. There's a 12-hour shift, and after the 12-hour shift, you have to give report, right? If every home health agency was actually going to wake up in the morning and their director of nursing was actually going to go to people's homes to make sure that everything was working the way it's supposed to, then I would grant you that truism that they actually supervise their caregivers. Don't confuse good business practice with supervision. For example, my children, well, now they're grown-ups, but when they were when they were in elementary school, they would run around the school and they would, have their beautiful paintings on the wall. And you go to a school on a Tuesday afternoon and you'll see kids running around. You go to a school on a Tuesday evening during parent-teacher conference and everything's put away and everything is clean and everything is fine. It's no different than what everyone calls a supervisory visit. When I call a family member and I say, Mrs. Jones, I'm coming to visit you. Oh, great, JB. I'm so excited. Thank you so much. Don't you think the caregiver is on their best behavior knowing that the person who found them the job is going to show up? Now, there is no difference. I strongly recommend that an agency do this and that a registry do this. There's nothing that stops you from good business of doing spot checks and showing up to see how how the client is happy with the referral and how the caregiver is doing. But it's a huge misnomer to believe that supervisory visits somehow are the responsibility of the agency and not the caregiver. The caregiver is the one that you want to make sure is credentialed, verified, and screened. Don't worry about their taxes. That's just
No, I wasn't worried about anybody's taxes. And it wasn't
right.
even,
Or the supervisory.
it wasn't even a question going back to that.
Right.
I mean,
Okay.
you kind of like morphed in, you like morphing into that, but we weren't even going there. But let me ask you this, with some states easing their restrictions, how is that impacting your members?
Again, everyone, I can speak for Florida best because I live in Florida, right? And so I'm also a professional court-appointed guardian. And I have cases in Palm Beach County, and I also have pro bono cases in Pinellas County. When I was in Pinellas County 2 weeks ago, dealing with one of my wards, their view of restrictions, they've eased restrictions, or they're already in full phase one. In Palm Beach County, where my office is, we're in phase one, but it's not a full-fledged phase one. You have to use common sense. And and we always make a joke that not everyone has, doesn't have it's not so common for some people. I think everyone is an individual, both as a registry owner and as a caregiver. I think everyone's doing what they feel most comfortable with. We were actually open for business. We took on patients that agencies could not take because they didn't have caregivers that were willing to work or were skilled to work with COVID-19 patients. So we did not. We're not reopening. We're just continuing. Obviously, our office was shut down and people were working from home, but our delivery of service continued. So to answer your question, everyone's doing it to their satisfaction, is doing it to the best of their ability. One of the greatest things that happened with COVID-19 is that I realized, maybe I like eating at home a lot more than I like eating out. And so everyone is going to kind of remove their restrictions, when it's comfortable for them. I will guarantee you this, dollars to donuts, that in a year from now, people will have a fog memory of what we went through. It's just human nature.
Now, our audience is extremely diverse, right? So what would you like them to know about the PCA and nurse registries that they might not know right now?
I would say this: ask the right questions. When you're looking for a home health care delivery system, make sure that you're comfortable with the answers that you receive rather than a regurgitated answer. For example, we have the best caregivers. We are the best in the business. Our caregivers are, are A, B, and C. Anybody who delivers an absolute to you, right? You should caution. I say this about people who have to go visit, let's say, an assisted living facility or a nursing home. They say to me, JB, what's the first thing I should look at? And I go, walk in there with your eyes and your nose, right? And that'll tell you a lot. When you go interview caregivers for care for your loved one, it should be second nature. It should be a conversation that flows. The caregiver and the registry owner should be able to answer all of your questions without any hesitation. If for whatever reason you think that the employee-based model just sits better with you, then good luck to you, and that's the way to go. You have to be comfortable in the delivery system. As a person who was born with a disability, I don't want a nurse telling me how much care I need. Right? I've been disabled a lot longer than they've been a nurse, so I don't understand why I would want a director of nursing to tell someone who either became disabled or is disabled about the kind of care they need. And that's why I philosophically believe in the registry model, because it allows you for self-determination as a consumer.
Yeah. See, JB, if somebody wanted to get information on the PCA or a nurse registry organization near them, how would they do that?
The best way to go is to go to privatecareassociation.org on our website. If nurse registries, either executives or owners, are listening to this podcast or YouTube or channel, there is a national conference. Now it's still scheduled to be in Orlando, October 21st to the 23rd. They're welcome to sign up and go to the conference. Or otherwise, if you're looking for a caregiver, right, you can go to the privatecareassociation.org and you can find a list of like I said, most of the registries that are members are national chains. So even though the membership numbers might be small, they represent thousands and thousands of caregivers and consumers. And like I said, the best analogy I can give you is there are only 33 baseball owners in North America, right? Yet they represent hundreds of thousands of fans who enjoy the benefit.
I appreciate your time, JB. I found it to be extremely educational. I did not know most of that about the PCA. So again, I just want to say thank you very much for your time.
My pleasure. Thanks so much for having me.